obviously better cosmesis. But this was just in the New England, or not in the New England, in the Wall Street Journal on Friday, Thursday or Friday, I believe, where a study that will be published in the Journal of the American Medical Association shows, and this is for hysterectomies, that there was no advantage to robotic-assisted surgery in terms of outcomes when looking at hysterectomies. And at the STS, Fred Moore, I don't know if you're familiar with Fred Moore, but he's been a very innovative surgeon, began using robotic surgery in Leipzig, Germany, probably about 10 years ago. And he has now abandoned it. He will not use robotic surgery anymore. And his rationale was that the cost of acquiring a robotic console and these arms is over $2 million. The annual upkeep cost is $250,000 that you have to pay for contracting and keeping it up. And then the disposables are about $750,000. So it's $1 million a year at his institution for the robotics, and you start out with a capital cost of $2 million. And he presented these slides. These slides are not what he presented, but they look exactly the same. This is for off-pump coronary bypass surgery at his institution. This connects directly with what Bill was talking about. And this is complications, and this is number of operations down below, and these are different surgeons. And what they showed is that as the surgeons began doing these procedures, that they would take on simpler cases, and as they got a little bit of experience, they began to expand what they did. They would be a little bit bolder, but without close monitoring, what they realized was that as they became bolder, they had more complications. And this is surgeons at a very good center. These are two surgeons at the same center that were able to have a relatively flat learning curve, and then as they got more and more experience, their complication rates went down. What he found, this is again for off-pump coronary artery bypass grafting, what he found for robotic surgery and less invasive mitral valve surgery is the vast majority of surgeons never turned it around. They couldn't make the turn into a low-risk surgeon. It was just too difficult to convert to this. So there were fewer and fewer surgeons as the procedure became more difficult that could get into this realm. So when he spoke at the meeting, he said it was simply too expensive, and I couldn't find that I could translate it into a technique that I could train and get my colleagues at a very high level. So he's abandoned robotic surgery. So it was very interesting to hear that side of the talk. This is another thing he looked at, and the differences, and it's very interesting too. This is the days between two operations, and as Bill showed you from the STS database, the vast majority of surgeons in this country do one mitral valve repair a month. And so as the time went on between the days between operations, there was an increasing rate of complications. And this makes sense, whether it's golfing or anything else. If you're not doing it every single day, practicing seeing it, thinking about it, getting experience, your ability to handle the unusual situation becomes a little bit more difficult. So what we're seeing at the clinic, and I'm sure at the Mayo Clinic and other centers, is that there's fewer and fewer surgeons doing mitral valve interventions as it focuses on one or two who get a wealth of experience with these more complex techniques and approaches to get the results that we expect with zero mortality, few strokes, and perfect repairs. And that's an interesting sort of evolution even over the past 5 years.